Welcome to the platform where medical topics are made easy. In this video, we're going to talk about pancreatitis. We're going to run through the important information you need to know, including the definition, acute versus chronic types, causes, symptoms, diagnosis, and treatment. You can find the timestamps for each topic in the description below. By the end of the video, you'll know the high-yield important information shown, so make sure to watch the entire video. We'll come back to these points at the end. As always, you can find all of the notes and images for the video linked down below. If you don't want to miss out on future videos and notes like this, make sure to hit that subscribe button. So turn on the captions down below and read along, and let's get right into it. First, we have to ask ourselves, what is pancreatitis? We know from the medical terminology video that the suffix itis means inflammation. So pancreatitis is inflammation of the pancreas. But where is the pancreas and what does it do? Here we have a picture of the abdomen. The pancreas is an organ located in the upper abdomen behind the stomach. We're going to color the pancreas red and move it in front of the stomach to make it easier to see. You can see how the pancreas normally sits behind the stomach, and much of it is located in the left upper quadrant. The pancreas produces enzymes and hormones that help with digestion and glucose control. Example pancreatic digestive enzymes include lipase, protease, and amylase. The pancreatic digestive enzymes are released into the duodenum or duodenum, which is the first part of the small intestine. The enzymes become activated in the small intestine to aid in digestion of fats, proteins, and starches. We also said the pancreas produces hormones. Examples include insulin, glucagon, gastrin, and amylin. Pancreatic hormones are released into the bloodstream to aid in glucose control and digestion. So what generally causes pancreatitis? Pancreatitis occurs when the digestive enzymes are prematurely activated in the pancreas rather than the small intestine, and the pancreas becomes inflamed as a result. We'll talk about what causes pancreatitis and the premature activation of enzymes soon. But first, there are two main types of pancreatitis, acute and chronic. Let's take a look at the difference between the two types, and then we'll talk about the causes, symptoms, diagnosis, and treatment. Let's look at acute pancreatitis first. Acute pancreatitis is an acute response to injury of the pancreas. It's an isolated episode in which there is active inflammation of the pancreas. While the onset of acute pancreatitis is often sudden and severe, it's short-term with a duration of days to weeks before resolving. Pancreatic enzymes are usually elevated since active inflammation is present, and this can be measured using a blood test. We'll talk more about that later. Alcohol and gallstones are common causes of acute pancreatitis. We'll talk more about the causes soon too. In most cases of acute pancreatitis, there is no long-term damage to the pancreas, especially if the episode of acute pancreatitis is mild and uncomplicated. However, acute pancreatitis may lead to chronic pancreatitis, especially if recurrent acute episodes occur. Unlike acute pancreatitis, which is an isolated episode, chronic pancreatitis is ongoing disease of the pancreas. There is recurrent or continued inflammation, which may result in chronic irreversible damage to the pancreas. Chronic pancreatitis may lead to fibrosis or calcification of the pancreas, and this can negatively affect its function in digestion and glucose control. Whereas the symptoms of acute pancreatitis are often sudden and severe, the presence and severity of symptoms in chronic pancreatitis can fluctuate. Some individuals with chronic pancreatitis can still have flare-ups or episodes of acute pancreatitis as well. Chronic pancreatitis is long-term and can persist for several months to years. Unlike acute pancreatitis, pancreatic enzymes may be normal or only slightly elevated in chronic pancreatitis. The reason the enzymes are normal is due to the loss of pancreatic function and fibrosis. Chronic pancreatitis can be caused by recurrent episodes of acute pancreatitis, ongoing alcohol abuse, or hereditary conditions and diseases like cystic fibrosis. Let's look at some of those causes now. The three main causes of pancreatitis to remember are gallstones, alcohol, and hypertriglyceridemia. They are the more common causes of pancreatitis and are also important to remember for board and medical exams. Exam questions pertaining to pancreatitis will often have a patient with a history of gallstones, alcohol abuse, or high triglyceride levels. Other causes include autoimmune pancreatitis, pancreatic duct injury, post-ERCP, which is a type of endoscopic procedure, biliary sludge, biliary obstruction, trauma, hypercalcemia, genetic disorders like hereditary pancreatitis, cystic fibrosis, and others, medications like valproic acid, ACE inhibitors, and others, and finally infections such as mumps, hepatitis B, cytomegalovirus, and others. Some causes are also idiopathic, in which the cause of pancreatitis is unknown. Smoking can also be a risk factor for pancreatitis. Let's move on to the symptoms of pancreatitis. Abdominal pain is the hallmark symptom of pancreatitis and is present in the majority of cases. The pain is often described as severe and sharp, located in the epigastric or left upper quadrant region, and radiates to the back. Epigastric or left upper quadrant pain radiating to the back is a buzzword phrase that commonly shows up on exams, so remember that. The abdominal pain is often worse during or after eating, and the pain may be worse with lying supine and may improve with leaning forward. Many patients will also have nausea and vomiting, as well as decreased appetite, weight loss, and changes to stool, especially with chronic pancreatitis. As mentioned before, the main symptom to remember clinically and for board exams is epigastric abdominal pain radiating to the back. Question stems for pancreatitis will often have a patient with a history of gallstones, alcohol abuse, or hypertriglyceridemia presenting with epigastric abdominal pain radiating to the back. Now that we know the symptoms of pancreatitis, what are some of the signs? Abdominal tenderness or guarding is often present on physical exam, especially to the epigastric or left upper quadrant regions. There may also be decreased bowel sounds as well. Jaundice, which is yellowing of the skin or sclera of the eyes, may indicate a biliary obstruction. Gray-Turner sign, which is ecchymosis or bruising in the flank, and Cullen's sign, which is periumbilical ecchymosis or bruising, may be present. These signs may indicate pancreatic necrosis and pancreatic hemorrhage or bleeding. Vital signs may also be abnormal, including elevated temperature, tachycardia or fast heart rate, and hypotension or low blood pressure. Abnormal vitals could be a result of pain, dehydration, systemic illness, or a combination. Now that we know the signs and symptoms of pancreatitis, how do we diagnose it? The current guidelines state at least 2 of the 3 of the following should be present to diagnose pancreatitis. First is an elevated lipase in the blood. Lipase is an enzyme produced by the pancreas to help break down fats during digestion. Inflammation of the pancreas can cause lipase levels in the blood to increase, which can be measured on a blood test. Lipase has largely replaced amylase as the blood test of choice, especially with acute pancreatitis. In acute pancreatitis, the lipase is typically at least 3 times the upper limit of normal. In chronic pancreatitis, the lipase and amylase may be normal because of the chronic damage and fibrosis to the pancreas. The second criteria is abdominal pain consistent with pancreatitis. If the lipase is elevated and there's abdominal pain consistent with pancreatitis, then pancreatitis is a likely diagnosis. Remember, the pain is often sharp and severe, located in the epigastric or left upper quadrant region, and radiates to the back. Finally, abdominal imaging such as a CT scan or MRI may show findings consistent with pancreatitis. It's important to note that abdominal imaging is not required to make the diagnosis of pancreatitis in most cases, especially in mild to moderate uncomplicated cases. If the history, physical, and lipase levels suggest pancreatitis, then it can be treated as such. Imaging may be necessary when the symptoms fail to resolve, the diagnosis remains in question, or if there's concern for underlying pathology, complications, severe presentations, or any other indication. This may include a peripancreatic abscess, pancreatic pseudocyst, necrotizing pancreatitis, pancreatic mass, or biliary obstruction. Other considerations for workup include a liver function test. An AST to ALT ratio greater than 2 could indicate alcoholic liver disease, and this could suggest alcohol abuse as an underlying cause to the pancreatitis. An elevated alkaline phosphatase may suggest biliary obstruction. For example, this could be from gallstones or a pancreatic mass. AST, ALT, and bilirubin levels may be elevated in the case of biliary obstruction as well. You should also consider working up underlying causes to the pancreatitis. This may include a right upper quadrant ultrasound for gallstones, asking about alcohol use, or obtaining a serum triglyceride or ethanol level. Other labs may include a metabolic panel, lactate, complete blood count, CRP, and stool studies, especially with chronic pancreatitis. Now that we know how to diagnose pancreatitis, let's review how it's treated. One of the most important steps in management of acute pancreatitis is IV fluid resuscitation. Be mindful of any cardiovascular or renal comorbidities that may require closer monitoring of fluids. Patients may need to be NPO initially if they can't tolerate oral feeds due to pain. Remember, MPO means nothing by mouth. Oral feeds should be started as soon as the patient can tolerate them. A low-fat diet may be recommended since lipase from the pancreas is used to break down fats. Pain and symptoms should be controlled with analgesics and antiemetics. Antibiotics are usually not necessary unless concerned for sepsis or other underlying infectious complications. Pancreatitis caused by gallstones may require intervention, such as an ERCP and cholecystectomy, to remove the gallstone obstructing the bile duct and to remove the gallbladder. Finally, education may be necessary to assist with smoking or alcohol cessation, lifestyle modifications, changes to low-fat diet, or changes to medications. Let's wrap it up with the high-yield buzzwords and learning points to know about pancreatitis. Remember, on exams, a question about pancreatitis will usually have a patient with a history of gallstones, alcohol use, or high triglyceride levels, and they're typically going to present with epigastric or left upper quadrant abdominal pain radiating into the back. Hit pause in the video to review the main learning points. Hopefully this helped you better understand pancreatitis. If you found the video useful, please show your support and hit that subscribe button. Don't forget to like and comment as well. As always, you can find all of the notes and pictures for this video on the website linked down below in the description. Thanks for watching, and hope you check out future videos.